including representatives from the Grand Traverse County Health Department, the Benzie Leelanau District Health Department of Northwest Michigan, District Health Department number 10, and Northwest Michigan Health Services. We are all here today to provide an overview of COVID-19 vaccine distribution in Northern Michigan. These are truly historic times, and we're excited to share this information with you. We'll begin with a clinical update from Munson Healthcare's Chief Medical Officer, Dr. Christine Nefsey. Dr. Nefsey?
Good morning, and thank you so much for joining us. We could just move to the next slide. So we're going to start with just an update on our numbers for our region. We have seen a decrease in the rate of rise, but we do still consider our numbers going up. We have remained steady at about 11% positive rate among our community members. We are currently at over 16,000 cases and over cumulatively 300 deaths for our region. So we consider to continue to monitor this and look at our cases per 100,000. Move to the next slide, please. And those, the increase in numbers is reflected in our inpatients. So we currently have 76 positive inpatients among our Munson Healthcare system. You can see in this slide how they are distributed across the hospitals here. This is some of the highest numbers we've seen since the pandemic started. Certainly under control as far as bed availability, but these are big numbers that we continue to monitor. So we are very grateful that we have vaccine in sight. Next slide. So let's talk a little bit about the vaccine. We know in general that we will have limited qualities of that vaccine. We don't have a lot of clarity of how much we will be receiving or when. We are getting vaccine distributed across the state, so it's not just the hospitals that are getting it, it is health departments as well. Understanding that we do have limited numbers, we will be distributing that vaccine based on prioritized status, on risk and other factors. We are working very closely with our health departments to distribute and administer those vaccines as quickly as possible. And we will be paying special attention to that equitable distribution and transparency as far as what we receive and where it's going. Next slide. So here's what we do know. We are currently in what we would call phase 1, that we have limited doses available. We have not yet received any vaccine at any of our Munson Healthcare entities. We are expecting to receive it this week, however. In the limited first distribution that we are getting, we will be assessing the tier 1A. So these numbers, or these tiers that you see, have been vetted through the state and the CDC. So tier 1A is healthcare personnel, long-term care residents. Tier 1B would be considered our essential workers. Tier 1C are our high-risk adults, and those greater than 65 years of age. Next. So again, we are expecting doses this week. Our plan is to begin administering those doses starting on Friday. So we will have clinics set up for our healthcare providers to start to receive that vaccine. The first healthcare providers and staff that we have identified are those that are working directly with or supporting the care of our COVID-19 positive patients in our high-risk areas. So our emergency departments, our urgent care clinics, our COVID-19 units and ICU units within our hospitals, our long-term care staff, and the residents. And again, as I mentioned, all of those people that support the care of those patients. Next slide. We do anticipate with the emergency use authorizations and others that we will be seeing increases in the number of COVID-19 vaccines that are available as we move into next year. We are hoping that we will be able to start making vaccine available to the general public sometime in the spring. In the meantime, it is really essential that we continue to act and avoid COVID-19 today. So please continue to wear a mask. Please continue to wash your hands frequently and avoid crowds and large gatherings. We do want to make sure people are aware there are many public resources speaking to vaccine, and particularly the safety and benefits. The Centers for Disease Control has some excellent information on the vaccines, as does our Michigan Health Department. Additionally, we do have information on our websites, and we have an Ask a Nurse hotline that's available. I will now pass on to our PharmD, Nick Torney. He is a specialist in our infectious disease pharmacy. And Nick, please take over.
Thank you, Dr. Nepsey, for that excellent background. And if you go to the next slide. So I just wanted to take this moment and comment on the safety and efficacy of the initial vaccines that are being studied and being produced. The safety of this is obviously a concern in the eyes of not only the public, but also the eyes of the healthcare industry. And I just want to inform everyone that the FDA really does have a rigorous process for approving vaccines for safety, and none of those processes were limited in the process of identifying a safe vaccine for COVID-19. There is still a vaccine and related biological products advisory committee, and the ACIP, which is the Advisory Committee on Immunization Practices. Both of these committees advise the FDA, and they provide advice on the safety and efficacy of these vaccines. There is not pharmaceutical representation on those committees or political, and this process has occurred for the Pfizer vaccine and will occur for the Moderna vaccine on the 17th of this month. Before any vaccine was developed, the FDA set the following safety and efficacy standards. So the vaccine has to be at least 50% effective in the population studied, and there must be a minimum of median 2 months of follow-up in large phase 3 trials, which has occurred for the Pfizer BioNTech vaccine. Next slide, please. So it does take a very long time to develop vaccines, and I just wanted to highlight a couple steps where this process, which normally takes years, only took 10 months. The main piece of that is the US government supplemented $10 billion for Operation Warp Speed, and that really is the main reason why it took the time down from years to 10 months. It took the risk out of doing a lot of the research and development process. Normally for for-profit pharmaceutical companies, they do phase 1, they wait, they do phase 2, and they wait, and they do phase 3. And between those processes, it takes time. However, there was an overlapping of these phases, and the reason that they take a break in between there is solely financial. When that financial risk is taken out of that, those phases can be much smoother and eliminate a lot of the backlog and red tape, so to speak. The manufacturers began producing this vaccine in March, and mRNA is incredibly easy to make. The technology has already been available. It's just a strand of nucleic acids, and we knew that code for the spike protein in January. And the distribution plans began developing almost immediately as soon as that vaccine was synthesized. Next slide, please. So the emergency use authorization is for children and adults 16 years and older. And as of right now, none of those phase 3 trials have included pregnant women or women that were breastfeeding. And the FDA does recommend that at this point in time, it's really a risk-benefit assessment, especially if that pregnant woman is working on the front lines. It is a risk-benefit assessment between the employee or the healthcare provider and her provider. Most people do not have serious problems after getting vaccinated, and we see that in 44,000 patients that were studied in this phase 3 trial. Many of the reported side effects were mild or moderate, and those included sore arms, maybe some redness in the arm, headache, fever, fatigue, malaise, and joint pain. Those are all very common among vaccines. The rates of those reported effects were they were common, but they were not. There were very few severe symptoms, and many of those symptoms went away within a week. The median duration of those symptoms was 1 day, and it took about 1 to 2 days to start. Next slide, please. So just to add to some of the FAQs that have been developed by the CDC and MDHHS, this vaccine will not alter DNA. You can think of it as a Post-it note that you write down as a reminder, for instance, and then it gets thrown away. That reminder is to make, it teaches your immune response, your immune system, to recognize and fight the virus and create antibodies towards the spike protein, which is only one of 29 proteins within SARS-CoV-2. And that, because of that, it cannot cause someone to test positive for COVID. It trains your body to produce antibodies against that. And it is unknown at this time if the vaccine prevents asymptomatic transition. We anticipate further evidence will elucidate this concern. There is currently no evidence or plausible mechanism to suggest that this vaccine causes infertility. The vaccine should not be given within 90 days of someone receiving a COVID-19 convalescent plasma or monoclonal antibody. And there is also preference to delay the vaccine in patients that have COVID-19 and tested within 90 days. So if given the limited resource, the guidance at this point is that it is not harmful to give the vaccine if someone has tested positive within 90 days, but with a limited resource, those individuals may be prioritized lower. If resources are limited, like I mentioned, that yes. So next slide, please. So we are working very closely with obviously Munson Healthcare and our local health departments to make sure that these vaccines are appropriately transported, stored, and are going to be immediately available once they arrive to begin administering. And our Munson Healthcare facilities, all Munson Healthcare facilities are equipped with all necessary freezers and equipment, and our staff are trained with the knowledge of how to handle these vaccines because they are different. And when they do arrive, we will be ready to store, distribute, and manage those. Next, please. And so it's important to note again, and just to reiterate what Dr. Nefsi said, that you might still get COVID, but these symptoms are less severe. And it's really just like a flu vaccine in that point. The vaccine is 95% effective from what we know right now. So there still is a small chance that you can get the virus despite getting the vaccine. And really we need to be continuing infection prevention measures such as masking, hand hygiene, and social distancing. And Dr. Nefsi supplied excellent resources, which I'll refer to her slide. So thank you very much for allowing me to join on this.
Great, thanks, Dr. Torney. I'd now like to welcome and introduce Wendy Hirschenberger from the Grand Traverse County Health Department for her statements. Wendy?
Good morning. I just wanted to thank Nick for that excellent summary. Great information. So I cover Grand Traverse County in our health department. So for our jurisdiction, we recently, unfortunately, received word of our 31st death this morning, and with us reaching nearly 2,500 cumulative cases so far, and continuing to see the current surge in cases, as Dr. Nefsi mentioned. This vaccine couldn't have gotten here, soon enough. It's the start of the end, hopefully, of the pandemic. So once we receive the vaccine, we will initiate a phased rollout and follow the vaccination plan, which is endorsed by the Center for Disease Control and the Michigan Department of Health and Human Services. These are plans that we have been anticipating and planning logistically for months. It's a big step forward in protecting our communities and helping to get our economy and just our normal lives back on track. And while this vaccine definitely offers hope, we do have to keep in mind that the vaccine distribution will take, a significant amount of time, anywhere from say 6 months to a year, and it will be a phased rollout of the vaccine. So for Grand Traverse County, we anticipate an initial shipment of the Pfizer vaccine within the week. Our focused distribution plan will start with the phase 1A priority groups and will include EMS, first responders, health department staff, who are the ones who are actually doing the vaccination clinics. And then we will switch over to non-hospital based medical workers and long-term care staff and residents who are not partnering with some of the major pharmacies. There are many long-term cares that have contracts with some of the larger pharmacies for vaccine distribution. So we anticipate this to happen throughout the rest of December and early January. We are, establishing our cold storage plans and transport plans. There's a lot of logistics with this vaccine. It's quite complicated, but we are confident that we have all of those steps ready to go, and we will be working closely with Munson and our neighboring health departments. And again, just one last point for me is, although the vaccine is here and we're starting to roll it out, knowing that we won't be able to get enough of the vaccine out until later in the spring and the summer to really achieve a level of herd immunity that's necessary to stop the pandemic, I do want to encourage people not to let their guard down and to continue to do the social distancing, wearing the masks, washing your hands, staying home with your sick, following isolation and quarantine guidelines. In the interest of time, I will stop there.
Great. Thank you so much, Wendy. We really appreciate you being here today. I'd now like to introduce Lisa Peacock, who is representing the Benzie Leelanau District Health Department and Health Department of Northwest Michigan. Lisa?
Hello, everyone. Thanks for having me today. And I think I can save a little time by maybe speaking about both health departments at the same time. So I'm the health officer for the Benzie Leelanau District Health Department, which obviously covers those two counties, as well as the Health Department of Northwest Michigan, which includes Antrim, Charlevoix, Emmett, and Otsego counties. Health Department of Northwest Michigan will be receiving its first shipment of the Pfizer vaccine in our Otsego County location. We're expecting it this week in the next couple of days. And we are intending to move forward in partnership with our partner health departments, including Benzie Leelanau District Health Department and District Health Department number 4, which includes Alpena, Sheboygan, Montmorency, and Presque Isle counties. And what we are doing together is trying to ensure that we have equitable distribution of that first allocation of vaccine across those health department districts, to ensure that we can get our EMS personnel and our vaccination teams vaccinated right away so that we can continue to move forward with other priority groups. Our goal is to begin vaccinating within 24 to 48 hours of receiving vaccine, and I think we are on target to meet that goal. Clinics are scheduled on Friday for those targeted priority groups and moving on through the weekend and early next week. And just some of our other strategies that we will continue to employ is we're working with our counties and our community partners to make sure that we are able to identify and reach out to those next priority groups that are coming up. Establishing electronic processes to make the process of vaccination go more smoothly when we hold these clinics, and as they grow in size, pre-registration type activities will be helpful and become even more important. We're recruiting extra staff and community volunteers to help us to be able to have a smooth process every time we hold a community clinic and to keep things really safe for everyone. And I, along with Wendy and Dr. Nefsi and all of our partners, just really encourage everyone to understand that the vaccine is one tool in our toolbox, and it is a very welcome tool. We've been talking for months about how difficult it is to manage a pandemic without a vaccine and without a treatment. And we're making progress in both of those areas now. We are very excited about that. But we need to continue using those other tools that are in our toolbox, including the things that everyone can do with social distancing, wearing our masks, keeping our gatherings small. And we as a health department, both health departments, will continue to do the things that we need to do to mitigate this risk of transmission, including case investigations and contact tracing and providing public education and information at every turn. And I think I covered both health departments, although
You did.
each one.
Thank you. Thank you, Lisa. We really appreciate you being here today and providing that perspective from both of those health departments. It's now my pleasure to introduce Janine Taylor, who is representing District Health Department number 10. Janine?
Hello, everybody, and thanks for having me on the call. I am the Public Information Officer for District Health Department number 10. We are a 10-county public health department that covers, I'm going to try to do this in alphabetical order, Crawford, Kalkaska, Lake, Manistee, Mason, Mecosta, Missaukee, Newaygo, Oceana, and Wexford counties. So we're a very large health department that spans a very large geographic area. I echo what both Wendy and Lisa offered in their statements, that I think we're all pretty much on the same page. The difference between their plan and District Health Department number 10 is that we are receiving the Moderna vaccine as our first shipment. We do anticipate getting that shipment late December, more specifically later next week. The number of doses is unknown at this time. We do anticipate having the Pfizer vaccine available at a later date in subsequent shipments, but Moderna will be the first shipment that we receive. We will begin with phase 1, and with 1A more specific, we will be supporting Munson in their vaccination efforts, as well as holding clinics for District Health Department number 10 vaccination clinic staff, EMS staff, and medical first responders starting the week of December 28th. And we also will ensure that the skilled nursing or long-term care facilities in our jurisdiction will either they'll be partnered with CVS and or Walgreens, and if for those that are not partnered, we will plan on vaccinating and have a vaccination plan for those facilities that are not partnered with the pharmacies. For all other phases going forward, again, we'll continue to support Munson in their efforts and plan vaccination clinics as well for all of the phases and into the spring, summer, when we hope to have it available for the general public. We do have a hotline number that individuals can call within our 10-county jurisdiction. The number is listed below, 231-305-8675. We also have an email that's available to the general public for questions, and that is covid@dhd10.org. Thank you very much.
Great, thank you so much, Janine. It's now my pleasure to introduce Heidi Britton, who is with our partnering federally qualified health center, Northwest Michigan Health Services. Heidi?
Hello, and thank you for having me today. I'm Heidi Britton. I'm the CEO at Northwest Michigan Health Services, and we are a federally qualified health center serving Western counties from Traverse City down to Shelby, so about 200 square miles on that. Our mission is to provide healthcare for some of our most vulnerable people, and we take this role very seriously. Since April, we have been preparing to distribute the COVID vaccine, and we feel that we are ready. During that time, we have been provided COVID testing and no-cost flu vaccines at our Traverse City, Benzie, and Shelby clinics. Through these programs, we've learned so many lessons in order to make it easier to get the vaccine out when available. So we've created curbside clinics, easy stay in your car and make it quick. And we'll be introducing our medical mobile vans, which will take the vaccine out into the community to reach some of our most rural areas. NMHSI has partnered with a statewide vaccination distribution network among healthcare centers. And this distribution network means we will be among the first to receive the COVID vaccine for our healthcare workers outside of hospitals. The next priority for distribution will emphasize getting the vaccine to our rural community, with our top priorities will be serving people with chronic illnesses, homeless, migrant, or agricultural workers, group living, minorities, and those with barriers to accessing healthcare, especially those with language barriers. So NMHSI is excited to start this new phase of our COVID response and happy to partner up with our local health departments in Munson to make this happen. Thank you.
Thank you so much, Heidi. And thank you, everyone who has participated so far. We do have time for a Q&A session, so I would ask that reporters please submit their questions using the Q&A feature on this Zoom. We do have some questions that have already come in. If I could have all of our speakers pull their videos back up and also unmute yourselves as I call on you, I would really appreciate it. So the first question we're getting, and it's a very popular question, is about the number of doses. Dr. Nefsi, do we have any more information on for Munson Healthcare on the number of doses that we will be receiving?
Yeah, thanks, Diane. What we've been told by the state is that we can expect 2,925 doses of Pfizer vaccine sometime this week. We have not received any yet. We were told that anywhere between today and Thursday would be when we are expected to receive that shipment, and that is basically all we know at this point. We have not heard of any set distribution plans for the Moderna vaccine. We have been told that the second dose that's required from the Pfizer vaccine will be sent to us as well. So that would be an additional 2,925 doses that we would expect to receive in the next 3 weeks. But that's what we know, and that's for the entire system. So we will be, again, distributing that as equitably as we can across all of our regional hospitals.
And that does speak only to Munson Healthcare's portion, as Dr. Nefsi and Dr. Torney mentioned, that local health departments and other partnering pharmacies will also be receiving doses. So I think the representatives from the local health departments have covered that in their statements already. So we'll move on to the next question. And I think this one is appropriate for Dr. Torney. We're hearing that there's going to be two different manufacturer doses, Pfizer and Moderna. Can you speak to the difference that you anticipate between the two and whether or not someone could receive a first dose of one and then the second dose of the other, or is that not possible?
Yeah, it's an excellent question. And we have a full manuscript on the Pfizer vaccine, so we know that vaccine, the information on that, much more detail than the Moderna vaccine at this time. But what we know about the Moderna vaccine is that both of them are very similar in efficacy, about 95% effective after 7 days after the second dose. We know that the Pfizer vaccine is 2 doses 21 days apart, and the Moderna vaccine is 28 days apart. We know that they're both mRNA vaccines, and they both target the same protein that I mentioned, the spike protein. And we know that the Moderna vaccine is much easier to store, so the storage requirements are much easier to work with that. And also, there is safety data on the Moderna vaccine in press release as well, and it looks very similar to the Pfizer vaccine in terms of mild side effects that occur in the first few days after receiving the vaccine. As far as which would be preferred at this point in time, that is not indicated at all by the FDA, and it is really on a first come, first serve basis.
Great. Thank you, Dr. Torney. On a related question that I think you're the most appropriate person to answer this as well. In regards to the vaccines from different manufacturers and the different efficacy that they're currently reporting, are there any concerns that you or Dr. Nefsi have related to these different manufacturers and the efficacy of them?
So at this point in time, there's multiple vaccines that are being studied and ongoing in phase 3 trials. What I envision is that there will be a few vaccines that will become they're much easier to be mass produced and will be used in general populations, and there will be some vaccines that may be prioritized for specific populations based on the data that we see in those vaccines. It's too early to tell at this point anything from any of the other vaccines because we do not have the full data on them. And so I can't comment specifically on that other than to say it's just going to take our agencies, the ACIP, to weigh in on that decision.
Great, thank you, Dr. Torney. The next question is for Lisa Peacock. Could you please clarify when the first shipment will come to Otsego County?
Sure. Similar to what Dr. Nefsi said, we are expecting 975 doses of Pfizer vaccine to be delivered to the Otsego County location. And we are also expecting it, we were told, anytime between today and Thursday. So any minute.
Great, thank you. The next question is for Dr. Nefsi. There are a couple of questions related to the same topic, which is mandating the vaccine for employees. And I know we've had this conversation specifically at Munson Healthcare. Other businesses and employers are wondering, such as schools, can schools mandate this vaccine? Can you please speak to that?
Well, I can't speak to other organizations. I can tell you we have no current plans to mandate the vaccine. I'd say that would be relatively irresponsible given the fact that we don't have enough vaccine to give everyone at this point, so mandating it doesn't really make sense. We are, however, highly encouraging all of our healthcare providers who are all at a bit higher risk given the work that they do to receive the vaccine if they want to.
Okay, and Dr. Nefsi, while your mic is still open, question came in is, if you have antibodies, do you still need a vaccine? And if you get a vaccine, will you still have to wear a mask?
So those are good questions. So let's start with the last one first. Yes, we would strongly encourage everybody still take the steps to prevent the spread of both COVID-19 as well as influenza while we are standing up this vaccine program. So we are not changing any of our masking guidelines or anything like that for our hospitals and staff. So we would recommend that you continue to practice social distancing, hand washing, and masking until we have a much larger number of people vaccinated against this disease. So to answer the first part of the question, there is some variability in the immune response to getting COVID-19 naturally. So, some people have a strong immune response and some people don't have a strong immune response. What we know from the vaccines is that you have a relatively stable, strong immune response. So even if you've had COVID-19, the recommendation is that you still receive the vaccine, and that is entirely safe to do. So antibodies to COVID-19 that were acquired naturally are not a contraindication to receiving a COVID-19 vaccine.
Great, thank you, Dr. Nefsi. The next question is for Wendy Hirschenberger. And I'm calling on you to speak to this one, but the other panelists may also want to weigh in, is can you better explain the interplay between the health departments, the hospital system, and long-term care facilities more in depth? Specifically, who is getting how much, who's responsible for those long-term care residents? Wendy, could you speak to that briefly?
Sure. So long-term care facilities were offered the option to partner with some of the national pharmacies to vaccinate their staff and their residents. And I think District Health Department 10 mentioned that it's CVS and Walgreens. So health departments and hospitals will help in those who have not fallen under the contracts. So for Grand Traverse County Health Department, any long-term cares in our jurisdiction who did not get the contracts, we would then take on vaccinating them. We will be receiving 975 doses, same as the others we anticipate this week. That's what we know at this point. And then we also don't know moving forward. You know, we're all waiting to see what the cadence of the vaccine distribution will be. So we will all be working closely together to assess as we go and ensure that we're working at a similar pace and tackling the priority groups as they roll out. Does that answer the question?
Yes, thank you,
Okay.
Wendy. The next question I am going to ask Lisa Peacock to weigh in on. Lots of questions around when do you think a vaccine will be available for the general public?
Well, I think none of us have an exact answer to that question, MDHHS has laid out a timeline that they anticipate, and that is that it would take about 20 weeks to get through these priority groups and get to that phase 2 of the vaccination timeline, which is when it becomes available to the general population. I do want to say, though, that there are lots and lots of people that are in the priority groups that include, you know, people over age 65 and over, people with underlying conditions, lots of critical infrastructure workers. So we anticipate large clinics on a large scale before we get to that point for certain.
Great, thank you, Lisa. The next question is for Dr. Torney. Could you please clarify your statement around people who have had COVID-19 recently and whether or not they should get vaccinated, and especially those who may have tested positive or had the virus more than 90 days ago?
Yes, I can. So Dr. Nefsey added a comment eloquently stating that, yes, if you have COVID, if you've had COVID in the past, it is still recommended to get the vaccine, and that the antibody response is much more reliable from the vaccine. The statement that I mentioned is in regards to when there are limited vaccines available and how prioritization would occur, in that if you've had COVID-19 in the last 90 days, those individuals, it may be, and again, this is just a general, this isn't a firm recommendation, but it may be reasonable to delay vaccination in those individuals that have had a positive COVID test in the last 90 days, to then vaccinate others that have not had a positive COVID test in the last 90 days. So does that clarify the question? And if Dr. Nefsey, if you have anything to add on to that.
Yeah, I would say, you know, the recommendation is after that 90 days to get the vaccine. The other question that we've seen come up with some frequency is, if I've been exposed, should I still get the vaccine? And what we're recommending, and this is supported by the state's health department, is that if you've been exposed, you should finish your 14-day quarantine and then get immunized.
Great, thank you both for those detailed answers. And again, we will continue to provide updates and clarification as needed as new information is learned. This next question, I'm going to ask Heidi Britton to comment on. And can you speak, because you're representing the federally qualified health centers, thought this might be a good question for you. Can you speak at all to the cost of the vaccine and what people could expect to pay? There is information out there that it will be made free to everyone eventually. Could you speak to that?
Sure, I'll do my best. I don't have obviously the 100% answer, but we've seen through COVID testing that was free to the public at no cost. And so I'm anticipating the same to happen with the vaccine. But again, we have not had any clarification on that yet.
Okay, great. And Dr. Nefsi, we have a question about dialysis centers and particularly staff and patients who work or are undergoing dialysis. Where do they fall within the tiered distribution?
Yeah, that's a great question. They are actually right behind this initial phase. So we have identified some of those patient groups that frequent our hospitals and clinics that are at higher risk than maybe the general public. So we do have a group identified right after this initial group that will be next in line to receive that vaccine.
Great, thank you, Dr. Nefsi. This next question is for Lisa Peacock. The question is, there are longstanding plans for medical health emergencies have called on local health departments to establish point of dispensing sites. In Leelanau County, are there plans for any of those to dispense the COVID-19, and where would those sites be located? Maybe too early to tell. So.
No, it's an interesting question because I was just discussing this yesterday with our team and talking about the definition of a point of dispensing site. So, typically in emergency preparedness planning, we plan for mass vaccination, and our plans roll out through both closed point of dispensing sites, which means targeted groups that need to be vaccinated first that can help us with distributing the vaccine and ensuring that we can get to those groups quickly, and then open point of dispensing sites where we then have locations that we've planned for and made arrangements for and agreements upon to dispense to the general community. And so that concept is well at play already in the planning. Our closed point of dispensing sites look a little bit different as we focus on the local health departments having responsibility for the EMS personnel and vaccination teams initially. We are holding those clinics within our health departments for the most part. Some jurisdictions may be going directly to those EMS where they work, which would be a normal point of dispensing site, but it's the same concept with maybe a different site, just because the logistics are going to work a little better this time for that.
Great, thank you so much, Lisa. And in the interest of time, we have time for just 2 more questions. This next question is for Janine Taylor. Can you speak to why, is there any rhyme or reason that you may be getting more Moderna instead of Pfizer? And I know all of us have had that same question and are kind of trying to understand what doses we're going to be getting, but could you speak to that just a little bit more, please?
Sure. From my understanding, the Michigan Department of Health and Human Services made the decision on who gets what vaccine initially for that first shipment. And at the time they made the decision, a lot of it was based on whether local public health departments had proper refrigeration to be able to maintain that vaccine. And I think when they did their initial survey, District Health Department number 10 was still working on our contract for refrigeration for the Pfizer vaccine. And so we now have that in place, but the state health department designated that we would get the Moderna vaccine first. And again, that was, I think, choice made on various things, including refrigeration capabilities. And really, we're getting it just a week after the initial doses of the Pfizer vaccine are coming to other health departments. So while others are getting theirs this week, we anticipate getting ours next week for Moderna, and later in the week though. And we also have the Christmas holiday to think about too, but we do anticipate beginning our vaccination plan for the priority groups that following week, the week of the 28th.
Great, thank you so much, Janine. And we are out of time for today. There was another question related to how we plan to continue to educate and inform the community. We are hoping to do press conferences like this on a weekly basis with as many representatives and speakers as we can accommodate. We will also be posting additional information on all of our websites and providing as much continued education as we possibly can. So please go to munsonhealthcare.org /COVID vaccine for additional information and FAQs today. And also please visit the local health department websites and the Northwest Michigan Health Services website for additional information. So again, I would like to thank everyone who has joined us today. If you did submit a question and we didn't have a chance to answer it, we will be looking at those questions and providing some answers on the FAQ section of the munsonhealthcare.org website. So again, thank you all and have a wonderful day.